Welcome you all to this Facebook Live event sponsored by the American Brain Foundation about stroke. First, a word about myself. I'm a stroke, my name is James Grotta, of course. I'm a stroke researcher and clinician from Houston, Texas. I've been involved in acute stroke treatment and research for 40 years here at the Texas Medical Center. Currently, I am at Memorial Hermann Hospital, where I run the mobile stroke unit, which is a specialized ambulance that manages stroke patients in the pre-hospital setting. And I'll say more about that in a few minutes. As I go along, please make comments, and if there are things that I'm saying that are not clear or you have questions, please raise them. I'll try to address them as we go along. A word about the American Brain Foundation. The American Brain Foundation is an organization that sponsors research in stroke, all aspects of stroke and brain disease. Right now we're going to talk about stroke, but as we know, there are many different brain diseases. Go from the common ones like stroke to include dementia like Alzheimer's disease, Parkinson's disease, epilepsy, and then of course the neuromuscular diseases. All of these are diseases that are addressed by the American Brain Foundation in trying to find treatments for all of these conditions. We've made tremendous advances in all of neurological treatment. When I started 40 or 50 years ago, there were no treatments for any of them, and now they are among the most treatable conditions. And we're going to talk today about stroke. A lot of times, and particularly in the current COVID era, we're so focused on COVID, we forget that people are getting other diseases, and the usual problems aren't going away. We've stopped at our hospital all elective procedures, but stroke isn't elective. Stroke happens whether there's COVID or not. And so what I want to focus on today is how we can deal with stroke, prevent it, and manage it in this era of COVID, which hopefully will end sometime in the next month or two, depending on where you are in the world and where you are on the curve, so to speak. Just to put this in perspective, Anthony Fauci, who's the director of NIH's infectious disease section, who actually I used to work under many, many years ago. He's an outstanding guy. He's predicted something like 100,000 deaths from COVID in the United States. Well, there are about 100,000 deaths from stroke in the United States every year. So actually the scope of stroke and the scope of COVID in terms of the numbers of deaths is somewhat comparable. And so obviously we can't ignore stroke or heart disease or any other common conditions just because COVID is going on. And so, but definitely the presence of this pandemic has affected the way we manage stroke and the way, as physicians and as nurses and as healthcare providers. And it also affects the way patients and patients at risk for stroke are dealing with their disease. So let's start. I think maybe one way to do this is to go through just a few seconds about what stroke is for those of you who may not know what we're talking about when we talk about stroke, and then talk about going through stroke from the beginning when you first notice the symptoms to prevention and recovery. So stroke, when we talk about stroke, it's obviously a brain attack. It's a brain disease where the blood vessel in the brain supplying blood to the brain blocks off suddenly and results in death of the brain tissue, and that results in a neurological deficit of one sort or another, depending upon what part of the brain is affected. There's another kind of stroke caused by bleeding in the brain, which is just the opposite. Instead of a blood clot, which blocks off the artery, you have bleeding in the brain. There are very good treatments, but the treatments are opposite for uh, the blood clot type of stroke. The treatment is to get initial treatment is to get that clot dissolved and open as fast as possible, and we now have excellent ways to do that, but it has to be done quickly. Um, with hemorrhages, you obviously don't want to give medications that are going to promote bleeding. You want to stop the bleeding, and you want to do things like control the blood pressure and control any things that are contributing to the bleeding. And then once the patients get in the hospital, we'll talk about other treatments. But that's what stroke is. And the most important thing if you don't remember anything else in this talk, is to know what the symptoms are of a stroke and the necessity to respond quickly. So the best thing to do is to remember the phrase FAST. That's what the stroke community, the American Heart Association, the American Brain Foundation, and everybody uses to have people keep in their mind as to what the symptoms are of a stroke. So think of the word FAST, F for face. So if one side of your face starts drooping, arm, A for arm. So if your arm suddenly can't lift your arm or your leg, but usually the arm is weak or numb. S stands for speech, if your speech gets slurred or you can't talk. And T stands for time, the need to react right away and call 911. So if any of those things occur, it could be one of the two types of strokes I mentioned. There are other symptoms: severe headache, severe vertigo, visual loss. Those are other common symptoms with stroke, but generally it's going to be one of the things I mentioned, either some sort of face symptom on one side, arm, speech, and it's going to come on abruptly. So let's talk about when people have a stroke. The first thing that you need to do is to call 911. And with COVID, what we found is some substantial changes in this. Across the country, stroke specialists have noticed that the number of people calling, alerting 911 for a stroke has gone down considerably. And I think this is understandable. People hear about going to the hospital and all the COVID patients in the hospital, and they think, well, this is a mild symptom of a little bit of numbness. It's going to go away. I really don't want to go to the hospital. I don't want, the medics are involved, in which they are. We're having thousands of COVID related calls to our fire department and our EMS agencies. They're overwhelmed by COVID related calls. But that should not stop you, if you're having stroke symptoms, from calling for help. If you call 911, you're going to get treated faster and better than if you go to the hospital on your own. And definitely, if you don't call and don't get treated and don't get to the hospital, you're not going to get treated at all. And so this is critically important for people who are having stroke symptoms, COVID or not. Do not delay in calling 911. Our EMS agencies, while busy with taking care of COVID, are not any less focused on dealing with stroke patients or able to deal with them. And this notion that you're having just a mild symptom, or even if you have symptoms that go away and it's a TIA, that's what we call a TIA, or transient ischemic attack. It's basically a stroke that fortunately resolves within a few minutes, but these patients are at high risk for developing another stroke. So it's very important, if you have any symptoms, even if they get better or if they're mild, to call, because they could easily worsen. And mild strokes are the ones that often respond the best to our clot busting treatments. Here in Houston, we have a mobile stroke unit where we can, if someone calls 911 with a stroke, we actually dispatch the mobile stroke unit, and it goes to the scene where the patient is having their stroke, whether at home or at the workplace, and we can treat them. We can do a CT scan and image them and determine if they're having a blocked artery or a bleeding in their brain, and treat them right there. And that saves a substantial amount of time, because the faster you get the artery open or the faster you limit bleeding, the less disability and the less severe the stroke. So that's what the mobile stroke unit does. We're still operating, but the way we do it is instead of me being on the mobile stroke unit, I'm here in my study like you see me now, and I can oversee the management of the patient on the mobile stroke unit by telemedicine. And so that's one of the themes I'll going to come back to, that one of the changes that we've made in our practice of stroke care and in all aspects of medicine is the greater reliance on telemedicine for seeing patients. This way, I don't have to, I can cover multiple mobile stroke units. I can also cover rounds in the hospital and still be here remotely and not necessarily be exposed. You can see by my gray hairs that I am in considered the vulnerable population. I'm over 70. So I should be particularly careful about exposing myself to COVID. But all of us as healthcare providers need to, and in the public obviously need to be careful. So, but I guess the most important point I want to make about the pre-hospital setting is don't avoid calling 911, or if you're thinking you're having symptoms or you see somebody else. Remember, it's usually not the stroke patient that calls 911. It's usually the bystander or the family member. Usually the stroke patient is not aware or doesn't really realize how severe their symptoms are. And it's the person near them or next to them or the family member who's got to call 911 and make sure that person gets help. Now, in the hospital, once the patient gets to the hospital, our emergency departments are there's no question, they are busier than before. But in most places in the country, things are under control. Clearly, you read about what's going on in New York, and I've talked to my colleagues in New York. Things are awful there in their main medical centers, clearly crowded and stressed. But in most parts of the country, our emergency departments and hospitals are able to sequester and deal with our COVID patients. So that if it's a known COVID patient that comes to the emergency room, they're going to go to a separate area. So if you have a stroke and you come to the emergency department, you're going to get managed as a stroke patient. Yes, their healthcare providers are going to have more gowns and protective equipment like masks and all the rest, but they will be able to take care of you just like they normally do. There's going to be some changes in the way we handle imaging. For instance, we have to wipe down our imaging equipment much more carefully after each image. We have to make sure that our rooms are wiped down after each patient comes in. And patients are going to be bypassed through the emergency room as fast as possible and getting up to wherever they need to go. And actually, that may be a positive side effect of COVID, and that we can learn how we can streamline some of the things we do in the emergency department to avoid unnecessary stuff going on in the emergency department and move patients a lot faster. I think we've all had the experience of being in the emergency room and having to sit there and wait to get taken care of because sicker patients may be there. Well, no one's sicker than a stroke patient when they get to the emergency department, so they need to be moved quickly. And we're learning with COVID how to do that even better. When you're in the hospital, most hospitals now have limited visiting in the hospitals from visitors, because we've learned that it's actually the visitors that tend to spread the disease the most in the hospital, because they'll go to a patient's bedside, and whether it's COVID or any other infectious problem, and they'll be exposed to that patient. Then they go down to the cafeteria, and then they spread the germs in the cafeteria or on the elevator buttons or whatever. So that's the reason why we've limited visiting in the hospital. But what we've done is we've provided our patients with tablets so that they can communicate with their families remotely. Well, this has become quite popular, and it may be going forward that we'll be doing a lot more of this, where patients and family can visit much more frequently remotely. And while you're in the hospital, make the hospital stay a little less painful. Um, Probably there has been an impact of COVID on the length the patients are in the hospital, particularly uh, um, trying to get patients out of the hospital as fast as possible, and discharge disposition and elective procedures. If you have a stroke and we find, for instance, that you need to have a procedure to reduce the risk of another stroke, and that procedure doesn't need to be done, though, for a few weeks, rather than doing that in the hospital, we may put that off, just like other quote unquote elective procedures are put off until later right now, while we're trying to limit our, sorry about that, um, while we're trying to limit our what we do. Um, the neuro intensive care unit is really the big area where where we have a crunch for beds, because the COVID patients, the sick COVID patients, of course, require ventilators. That's the biggest problem with COVID. Is the obviously, as you know, it's a respiratory infection and it causes very severe breathing problems, and so patients frequently, obviously, we all know the statistics that most patients with COVID don't need to even be hospitalized. And then even those that do don't need to go on ventilators. But there is a proportion of patients, you know, over 10% who do need to go on a ventilator and a respirator. And so these patients need to be in the intensive care unit, where oftentimes stroke patients go. So there is um, uh, a crunch for beds in the intensive care unit. And so, but there still are, in most hospitals, adequate number of ventilators and intensive care intensivists to take care of the patients who have strokes. So again, don't worry that if you have a stroke, you go to the hospital, you're not going to get the care you need. You are going to get the care you need. Now, there is going to be a lot more, as I said earlier, a lot more gowning and a lot more shuffling of beds in the ICU than normal, but you're still going to be able to get the care you needed. That includes surgery if you need it. We do find that a proportion of patients with strokes do turn out to have COVID, and it's one of the interesting, from a neurologist standpoint, aspects of COVID, and just about every specialty is learning this, that this infection seems to affect more than breathing. It can also affect the nervous system in other ways. And one of the ways is by causing stroke. We think that COVID, we don't know this for sure, but we do think that COVID causes more blood clotting in the blood vessels and may predispose you to have a stroke. So we're finding that a reasonable proportion of the patients that come into the hospital, not knowing that they're COVID positive, with strokes, then we test them, they turn out to be COVID positive. And in fact, it's a clue that we find that some patients who have the breathing problem of COVID, that some of that breathing problem is actually due to blood clotting, and might be treated by some of the same drugs that we use for treating stroke patients, clot busting drugs like we give in the mobile stroke unit and in the emergency department. Another very powerful treatment that we do in the hospital for treating strokes is what's called endovascular treatment, where we can actually use catheters to pull the clot out of the artery. Again, this is very time sensitive. You have to go to the right hospital if you're having a severe stroke. That's all the more reason to call 911, because the medics are going to know which of the hospitals have that capability and bypass the smaller hospitals that can't. And usually the patient will go very quickly up to the endovascular suite. So we still are able to do this for our severe stroke patients. It's an extremely powerful treatment, and one that can take a patient who's completely paralyzed and in minutes bring back their ability to move and talk and do all the rest. So what happens when you leave the hospital? When you leave the hospital, or if you have clinic appointments, we've moved all of our clinics entirely now to remote visits. So when I have my clinic with my stroke patients, I seeing them like this by telemedicine, and it's turned out to be very useful, and patients like it. They're not affected by it adversely. We're able to examine patients neurologically very well remotely because, unlike some things, I mean, I do listen to the heart sometimes, but really for a neurologist, what I want to see is, how well are you thinking? How well are you talking? How well are you moving your arms and legs? And, how well are you coping at home with your symptoms if you've had a stroke? And if you've not had a stroke, have you had any symptoms of stroke? All of that can be done remotely on a video link, a video and audio link. So we're finding that, as with other diseases, stroke patients can be managed remotely. And as a matter of fact, I should have mentioned this earlier, telestroke or telemedicine for stroke, stroke was one of the first diseases to be applied, where telemedicine was applied, where we could use telemedicine to assess patients in rural, remote emergency departments where no neurologist exists, and be able to carry out stroke treatment just as if they were in the major medical center. So we're not, as stroke specialists, we're not strangers to the use of telemedicine to manage our stroke patients. So we can do that very well with our stroke patients. And extremely important that in this COVID era, don't think your doctor's too busy seeing COVID patients to take care of you in the clinic. It's very important that you keep your appointment or make your appointment with your stroke specialist if you've had a stroke, or if you're having stroke symptoms, or you've had follow-up. So if you are one of those patients that's had a mild stroke or TIA symptoms and hasn't gone to the emergency room, please don't do that. But if you did, make sure you contact your neurologist, and even remotely, and that way you can have that neurologist can arrange for you to get managed and treated and on your medications. So I want to make that point extremely strongly. Be sure, and this is true during COVID or not in COVID, it's one of the biggest problems we have with stroke is that just as there are effective medicines to treat stroke, there are very effective ways to prevent stroke. This includes medications and lifestyle changes. So don't let your medications run out. Just because you can't go to the doctor, don't stop taking your blood pressure medicine, or don't let your blood pressure medicine prescription run out. Don't let your blood thinning, your anticoagulant medicine run out, or stop your anticoagulant medicine. Those are extremely important. Blood pressure is the single most important risk factor for stroke. So letting someone's blood pressure get untreated will lead to a stroke without question. So it's very important you don't run out of your medicines. And the same thing if you have atrial fibrillation and you're on a blood thinner and you stop your prescription, you're going to have a stroke. So just because we're doing remote office visits, that doesn't mean that you shouldn't have those visits with your doctor and take your medications. Same thing with lifestyle. I think, remember that just as important for stroke prevention as medications is lifestyle change, diet, exercise, things like that. So I know we're all cooped up in our homes, but that doesn't mean you still can't exercise. Go out, jog, do a stationary bike, take a brisk walk, and importantly, this is a good time to look at your diet. We may have trouble finding some of the things that we used to get at the grocery store, but diet is extremely important, and you can change your diet to a healthier diet. Now that we're perhaps more sedentary, it's even more important to be careful about what we eat. Just, it's really amazing to me that in almost overnight, we changed our lifestyle to a stay-at-home lifestyle based on this COVID pandemic. What a major change in the way we live our lives as a result of this. Well, if we can make such a dramatic change in our lifestyle as staying at home continually for months at a time, we can also make lifestyle changes that are healthy for us in dealing with stroke, like regular exercise and diet. So those are important things.